Hello friends, welcome to my channel. If you are new to the channel, then please do subscribe for more such creating videos. So let's get started. Today we will discuss about tetracycline. Tetracycline is an antibiotic having a nucleus of 4 cyclic rings. Here you can see the chemical structure of tetracycline with the 4 cyclic rings. Okay. Then all are obtained from soil actinomycete. The first to be introduced was chlortetracycline in 1948. All are mildly bitter solid, which are slightly water soluble. Doxycycline and minocycline have high lipid solubility and greater potency. For clinical uses, examples are tetracycline, oxytetracycline, demiclocycline, doxycycline, minocycline, and glycinylcycline, which is tiglicycline. Coming to mechanism of action, tetracycline is primarily bacteriostatic. It inhibits protein synthesis by binding to 30S ribosomes in susceptible organisms. It inhibits binding of amino acid tRNA to the acceptor site of mRNA, which leads to peptide chain fails to grow. Here you can see tetracycline inhibit the binding of amino acid tRNA to the acceptor site of 30S ribosome. As a result, enlargement of peptide chain, elongation of peptide chain get prevented. Okay, then it's a flowchart form. It's very important. Tetracycline bind to A site of 30S ribosomal subunit, prevent binding of tRNA to A site, prevent protein synthesis, bacteriostatic effect. Tetracycline sensitive organism have an energy dependent active transport process which concentrate tetracycline intracellularly. In gram-negative bacteria, tetracycline diffuses through the porine channels. The more lipid-soluble members, that is, doxycycline and minocycline, tetracycline enters the cell by passive diffusion. Selective toxicity. The carrier involved in active transport of tetracycline is absent in the host cells. Moreover, protein synthesizing apparatus of the host cell is less susceptible to tetracycline. These two factors are responsible for the selective toxicity of tetracycline for the microbes. Let's discuss the antimicrobial spectrum. Tetracycline inhibit all type of pathogenic microorganisms except fungi and viruses. In cocci, all gram-positive and gram-negative cocci were originally sensitive. But now only few streptococcal pathogens, Staphylococcus aureus and Enterococci respond. Responsiveness of Streptococcus pneumonia has decreased. Tetracycline, especially minocycline, are now active against Neisseria gonorrhea and Neisseria meningitis. Most gram-positive bacilli, example Clostridia, Corynebacterium, Acantharis, Bacillus anthracis, Mycobacterium leprae, which is sensitive to minocycline. Sensitive gram-negative bacilli are Vibrio cholerae, Yersinia pestis, H. pylori, that is Helicobacter pylori, Brucella, Haemophilus ducreyi. Spirochetes, including Treponema pallidum and Borrelia, are quite sensitive. All Rickettsia and Chlamydia are highly sensitive. Mycoplasma and Actinomyces are moderately sensitive. Coming to resistance. Resistance to tetracycline develops slowly in a graded manner. In resistant bacteria, usually the tetracycline concentrating mechanism becomes less efficient or the bacteria acquire capacity to pump it out. Another mechanism is plasmid mediated synthesis of a protection protein, which protect the ribosomal binding site of tetracycline. Let's discuss the pharmacokinetics. Sources. Tetracycline is a semi-synthetic drug and oxytetracycline obtained from Streptomyces rhamnosus. Demiclocycline obtained from Streptomyces aureofaciens and doxy and minocycline, which is semi-synthetic form. Potency. Tetracycline and oxytetracycline, which is low potency, Demiclocycline has intermediate potency. Doxy and minocycline which has high potency. Intestinal absorption 60 to 80% for tetra and oxy tetracycline, which is similar to demiclocycline also, which is 60 to 80%, and 95 to 100% for the doxy and minocycline, which is not interference by food. Okay, absorption of doxy and minocycline does not interfere in the food. Elimination, tetracycline and oxytetracycline eliminate by rapid renal excretion. Demiclocycline by partial metabolism, slower renal excretion. Doxycycline primarily excreted in feces as a conjugate. Minocycline primarily metabolized and excreted in urine and bile. Dosage 250 to 500 mg QID or TDS. For demiclocycline 300 mg BD. For doxy and minocycline 200 mg initially, then 100 to 200 mg once daily. Alteration of intestinal flora. Tetracycline and oxytetracycline, there is marked alteration in intestinal flora. Demiclocycline, which is moderate, and doxy and minocycline, least alteration in the intestinal flora. Incidence of diarrhea, phototoxicity and specific toxicity, which are side effect, and it will discuss in detail on the coming sections. Administration. Administered orally in the form of capsule. Capsule should be taken half hour before or 2 hours after food. Tetracyclines are not recommended by IM, intramuscular route, because it is painful and poor absorption. Slow IV injection may be given in severe cases. Topical application in the eye is also applicable. Coming to adverse effect. There is a mnemonic Kapil-Dev. K for kidney failure, A for anti-anabolic effect, photosensitivity, insipidus, that is diabetes insipidus, liver toxicity, dentition and bone defect, expired drugs, that is which will lead to Fanconi syndrome and vestibular dysfunction. Let's discuss detail. Kidney failure. All are contraindicated except doxycycline. Anti-anabolic effect. Tetracycline reduces the protein synthesis and have an overall catabolic effect. They induce negative nitrogen balance and can increase the blood urea. Phototoxicity. A sunburn-like or other severe skin reaction on exposed part is seen. Diabetes insipidus. Demiclocycline antagonizes ADH action and reduces the urine concentrating ability of the kidney. Liver damage. Fatty infiltration of liver and jaundice occur occasionally. Expired drug then causes Fanconi syndrome. This is caused by degraded product like epitetracycline, anhydrotetracycline and epi-anhydrotetracycline, which is important in MCQ point of view. What is Fanconi syndrome? Fanconi syndrome is a pathological condition of the proximal renal tubules of the kidneys. This is where glucose, amino acid, uric acid and bicarbonate, instead of being reabsorbed in the body, pass on to the urine. Clear? Okay, let's continue the adverse effect. Dentition and bone. Tetracycline have chelating property. Calcium tetracycline chelate is deposited in the developing teeth and bone. Given from mid-pregnancy to 5 months of extrauterine life, the deciduous teeth are affected. Brown discoloration, ill-formed teeth which are more susceptible to caries. Then vestibular toxicity. Minocycline causes vertigo, ataxia, nystagmus. Hypersensitivity. Reactions like skin rashes, urticaria, glossitis, pruritus and exfoliative dermatitis. Irritative effect. Epigastric pain, nausea, vomiting, diarrhea, etc. will develop. Thrombophlebitis of the injected vein can occur, especially on repeated IV injection. Esophageal ulceration has occurred by release of the material from capsule in the esophagus during swallowing, especially with the doxycycline. Superinfection. Tetracycline are frequently responsible for superinfection because they cause marked suppression of the resident flora. Precautions. Tetracycline is contraindicated in pregnancy, lactation, and in children. Should be avoided in patients taking diuretics because blood urea may rise in such patients. Should be used cautiously in renal and hepatic insufficiency. Preparation should never be used beyond their expiry date, which will lead to Fanconi syndrome. Okay. Coming to uses, orodental conditions. There is limited use. Periodontal diseases. Broad spectrum of activity. Tetracycline suppress MMP, matrix metalloproteinase derived from the neutrophils and fibroblasts. MMP is calcium-dependent enzyme. Tetracycline chelate the calcium, so calcium is not available for MMP to act. Tetracycline scavenges free oxygen radicals and reduce the periodontal inflammation. Used in the management of chronic periodontitis. Highly active against actinomyces, hence benefit on juvenile periodontitis. General medical uses. It is useful in non-serious infection and mixed infection. First drug of choice in venereal disease, atypical pneumonia, cholera, plague, rickettsial infection. Second drug of choice to penicillin for tetanus, anthrax and actinomycosis. To ciprofloxacin or ceftriaxone for gonorrhea. To ceftriaxone for syphilis. To azithromycin for trachoma and pneumonia. Other uses are community-based pneumonia, amoebiasis, chloroquine-resistant malaria, ACHIN and COPD, chronic obstructive pulmonary diseases. So guys, I hope this video is useful for you. Stay tuned, continue watching. Thank you. Please do subscribe my channel for further dentistry related videos. Thank you.